Hi, I'm Garvin. This telecast is on Zovirax. So Zovirax contains a medicine called Aciclovir. This belongs to a group of medicines called antivirals. It works by stopping the growth of viruses. Zovirax can be used to treat chickenpox, shingles, cold sores, genital herpes, and other herpes simplex infections. This drug is available to use in various different forms. It is used as a 200mg dispersible tablet, 500mg dispersible tablet, and 5% strength cream. There's a double strength suspension, an eye ointment, and IV fluid. The dispersible tablets can be dissolved in a glass of water and stirred before drinking. However, if you prefer, the tablet can also be swallowed whole with a little water. Start to take Zovirax as soon as possible. Drink plenty of liquid such as water while taking this medicine. For the treatment of chickenpox and shingles in adults, the usual dose is 800mg taken 5 times a day for 7 days. You should space each dose by 4 hours. For the treatment of cold sores and genital herpes, the usual dose is one 200mg tablet taken 5 times a day. You should take Zovirax for 5 days or longer if your doctor tells you to. Your doctor may decide to give you the dose by IV infusion if necessary. In order to stop these problems such as cold sores returning again, you can take a dose of 200mg tablet 4 times a day, spacing each dose by 6 hours. To prevent these problems in people whose immune systems don't work as well, the usual dose is one 200mg tablet taken 4 times a day, spacing each dose by 6 hours. Your doctor may adjust the dose of Zovirax if it is for a child. Other forms of this medicine, such as a suspension form, may be more suitable for children. Ask your doctor or pharmacist. For the treatment of cold sores and genital herpes in children 2 years and over, you give 200mg 5 times a day. In under 2 years, 100mg 4 times a day. To prevent these problems in children whose immune system works well, you give 200mg 4 times a day if 2 years and over. If the child is under 2 years, you give 100mg 4 times a day. To treat chickenpox in a child 6 years or older, it's 800mg 4 times a day, and 400mg 4 times a day for children aged 2 to 5 years of age. For under 2 years old, you give 200mg 4 times a day, and you should try to space the dose by 5 hours. Your doctor may adjust the dose of Zovirax if you're over 65 years of age or if you have kidney problems. For people aged over 65 years of age or with kidney problems, it is very important while you're taking this drug to drink water regularly. This will help to reduce side effects that can affect the kidney or nervous system. Your doctor will closely monitor you for signs of these. The side effects of this medication include a headache, feeling dizzy, diarrhea, or feeling tired. If you're using the Zovirax cream, it is not to be applied to your mouth, eyes, or vagina. You should not mix Zovirax with anything before you use it, not even water. Always wash your hands before and after you use this cream. For adults and children, apply a thin layer of cream to the affected area 5 times a day. Zovirax cream should only be applied externally for the treatment of cold sores and genital herpes. If your cold sore has not healed after 4 days, or your genital herpes sore has not healed after 5 days, you may use the cream for up to 10 days. If you're taking Zovirax oral suspension for the treatment of chickenpox and shingles, the usual dose for an adult is 4 5ml spoonfuls 5 times a day. The dose for cold sores and genital herpes is 1 5ml spoonful 5 times a day. To stop these problems returning, the dose is 1ml spoon 4 times a day. For children in the treatment of cold sores and genital herpes aged 2 years and over, you give 1 spoon 5 times a day. Under 2 years, you give 2.5ml spoon 5 times a day. For the treatment of chickenpox in children aged 6 years and older, you give 4 5ml spoons 4 times a day. In 2 to 5 year olds, you give 2 5ml spoonfuls 4 times a day. In under 2 years old, you give 1 spoon 4 times a day. If you're taking the Zovirax double dose suspension for the treatment of chickenpox and shingles in adults, the usual dose is 2 5ml spoonfuls 5 times a day. For the treatment of cold sores and genital herpes, the usual dose is 1 2.5ml spoonful 5 times a day. To stop the problem returning, the dose is 1 2.5ml spoonful 4 times a day. For use in children, the dose in the treatment of cold sores and genital herpes is a single 2.5 spoonful 5 times a day in those aged 2 years and over. In the treatment of chickenpox, a child aged 6 years and over, you give 2 5ml spoons 4 times a day. In children aged 2 to 5 years, you give 1 5ml spoonful 4 times a day. In children under 2 years, you give 1 2.5ml spoon 4 times a day. If you're using the eye ointment, the usual adult dose in children is 1 centimetre of Zovirax applied to the infected eye 5 times a day. To apply this ointment, wash your hands. Use your finger to gently pull down the lower eyelid of your affected eye. Tilt your head back and look up. Apply the ointment to the inside of your lower eyelid. Try to avoid the tip of the tube touching any part of your eye. Close your eye for 30 seconds. Wash your hands after application. A side effect of the ointment may include irritation, light sensitivity, or feeling as if there is something in your eye. For Zovirax infusion, you will never be expected to give yourself this medicine. It will always be given by a person who is trained to do so. Zovirax will be given to you as a continuous infusion into your vein. This is where the drug is slowly given to you over a period of time. So if you have an allergic reaction, stop taking Zovirax and see a doctor straight away. The signs may include hives on your skin, shortness of breath, unexplained fever or swelling of your face, lips and tongue. If you forget to take Zovirax, take it as soon as you remember. However, if it is nearly time for your next dose, skip the missed dose. Do not take a double dose to make up for a forgotten dose. Zovirax is not usually harmful unless you take too much over several days. Talk to your doctor or pharmacist if you take too much Zovirax. So check with your doctor or pharmacist before taking Zovirax if you have a kidney problem, or you are 65 years of age or over, or your immune system is weak. You must make sure you drink plenty of liquids such as water whilst taking this medicine. Food and drink should not affect the absorption of your medicine. If you're pregnant or breastfeeding, think you may be pregnant, or planning to have a baby, ask your doctor or pharmacist for advice before start taking Zovirax medicine. Some of the side effects, such as feeling drowsy or sleepy, may impair your ability to concentrate and react. Make sure you are not affected before you drive or operate machinery. The Zovirax cream should not affect your ability to drive or use machines. Tell your doctor or pharmacist if you are taking or have recently taken any other medicines. This includes medicines obtained without a prescription, including herbal medicines. In particular, tell your doctor or pharmacist if you are taking any of the following medicines: probenecid, which is used to treat gout; cimetidine for stomach ulcers; myphenonate, Mofetil. So if you have any other questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.